Do join us and stick with us for that. Now, over the last few weeks on this programme, we've been talking about the problems people are having getting a doctor's appointment. Some of you got in touch with us to say that it was particularly hard to get an appointment at the Lakeside Surgery in Corby, and the story during the course of the week then grew. One patient, Bob Riley, got so frustrated trying to get an appointment there that he set up a Facebook group for others. That was a fortnight ago, since which the page, and I quote, Lakeside Surgery Dissatisfied Patients, has grown to have more than 180 members on it. Now, we'll talk to Bob shortly, but first of all, this is Carol Matthews, who's been talking to Annabelle Amos about the problems that she had accessing an appointment at Lakeside.
So you have to phone up at 8 o'clock in the morning. I've got up to phone the doctors at 8 o'clock and can't get through. And you might actually get through 20 past 8 if you're lucky. And then you put onto a hold list. You could be 30, 40 in the queue, and you get through maybe 20 minutes later, no appointments left. So you've got to start that the next day. If you do get through and they say there's no appointments, what they're telling you to do is go to the urgent care centre. It's not always urgent care that you need. You just need to talk to a doctor. You might need a simple prescription.
A lot of surgeries operate the, call at 8 in the morning. And, I suppose a lot of people do have to wait a bit of time to get through. But this is on another level, is it? Yeah,
definitely on another level. I'll give you an instance. I phoned on the 12th of May. I knew I'd got an infection come on. I needed antibiotics. I managed to get through, I think it was at 20 past 8. No appointments left. Now, if I'd have got those antibiotics when I needed them, I would have been on them for 2 days. But instead of that, I ended up in A&E with breathing difficulties.
And I think your husband's had issues as well, yeah?
He's had a heart attack. He's got 10 stents fitted. And then he's got numerous problems with his back. He's had spinal stenosis. And he struggles to walk. He was due a review of his medication. 2019 was the last one that he had, a review of his medication. Now, he's on patches, morphine patches, and that, which aren't working, but he's left on them because he can't get a review of his medication.
So
nothing's been done.
What do you think needs to change then? What needs to happen? Because obviously, you're telling us this story, but we know that this is affecting quite a few people.
Some sort of normality, being able to see a doctor.
I suppose the thing is these the people who work there, they're not going in saying, right, well, we're going to avoid people today. It's obviously that they have just got a lot of work on, haven't they?
But where's all the doctors? That's a hell of a big practice. If those doctors aren't seeing anybody, where are they? If you can't even get a telephone... No, you're talking about a 5-minute telephone appointment. If you can't get a telephone appointment, where are those doctors?
Carol Matthews voicing her frustrations to Annabelle Amos here on BBC Radio Northampton. For their part, GP partner Dr. Rosalind West from the Lakeside Surgery has told BBC Look East that her team are equally frustrated. She said, "We understand and acknowledge the problem that our patients are facing, and we're sorry about that." She also said, "We've noticed patient demand to speak to a member of our team has surged significantly in recent weeks. We're trying to respond to the increase in demand as quickly as we possibly can." Well, the MP for the area, Tom Burstglove, is now involved. He said he's going to look into the issues at Lakeside.
Well, I think it's fair to say that Lakeside is one of the biggest GP surgeries anywhere in the country, not just locally, but obviously it serves a lot of patients in Corby. It's also got a base in Oundle, and there's patients in that part of my constituency who've raised similar issues. I'm just wondering if there is a process issue here that needs to be looked at, whether there's a capacity issue. And that's why what I've done is I've asked local people who've had difficulties in being able to access GP appointments to make contact with me, to let me know what difficulties they've had so that I can get a really full picture about precisely what's going on locally. And then what I want to do is to get our local health leaders from the clinical commissioning group and obviously the various GP practices involved in a bit of a dialogue about how we put that right. It may well be that there are some internal processes within practices that could be done better and best practice from elsewhere that that they could be learning from. Or it may be a resourcing issue, in which case I think we need to go back to the drawing board and look at what we need to do in resource terms to bolster this GP access and people's ability to be able to see their GP when they need to see them.
So that's MP Tom Pursglove. I said that we'd talk to Bob, who was the man who put this up in the first place, Bob Riley. Bob, thanks for joining us on the line this morning. I appreciate your own frustrations, which has really sort of brought this to light. How surprised were you that when you set up a Facebook page, almost 200 other frustrated patients joined you?
Not at all surprised at all. It's now up to 229 patients now. I'm getting more members every day.
Since you set up the group, the surgery, Lakeside, has released a few statements. The latest one revealed that Lakeside offers 4,000 appointments every week. They're being asked for 7,000. That's quite a gap in numbers.
Absolutely. Tom Pursglove said there's a resourcing issue. That's absolutely correct. There's not enough money going into the NHS, full stop. There's not enough money going into this surgery, full stop. They've not allowed for the expansion of Corby, and this is why we've got the problems.
There's a lot of pressure on the NHS in a variety of ways, most pressing, I suppose, the pandemic. A lot of people can't get hospital appointments. What do you think has been causing the delay at Lakeside, given that it is, as Tom Pursglove was saying, a very big outlet?
They were cruising for bruising well before the pandemic because they set this system in place where you had to phone at 8 o'clock on the morning. They set this system up about 5 years ago, which was well before the pandemic. So we knew that this was going to happen, and, our fears have come true.
OK, now your fellow group members have told you about the effects of not being able to get an appointment. We heard some of that testimony. Now Tom Pursglove is involved and the surgery itself has responded. We understand that there are telephone improvements in service on the way. We understand that other things may well be in the works. How confident are you now that things are going to improve, given the statements that have come from Lakeside, the fact that a local MP is involved, and the fact that there is so much public support for what you have been saying is an issue and what others have said in agreement?
I'm sceptical but hopeful. I've got a meeting with them on Friday, coming Friday at 10 o'clock with the wife. We're both going down. We were both on the Corby Borough Council Scrutiny Committee, on the Health Committee at the County Council. So we used to filter into the rubbish. If they try to pull the wool over our eyes, we'll know about it.
I'm sure, Bob, you'll report back to us and let us know how that all goes.
Will do. Thanks, John.
Bob, thanks very much indeed for joining us this morning. The ongoing issues at Lakeside Surgery in Corby. If you've got something to add on this particular story, we'd love to hear from you. You know how to get hold of us. 0800 030 4455 or text North and your point to 81333. Lakeside Surgery saying that we've noticed demand peaking and growing. We are trying to respond to the increase in demand as quickly as we possibly can.